call the quadriceps, namely rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis.
The knee joint is primarily a hinge joint, so it can flex and extend the leg at knee joint.
The muscles that flex the leg at knee joint are what we call the hamstrings, which are the biceps femoris,
The semitendinosus,
semimembranosus,
and the hamstring portion of the adductor magnus.
External rotation is done by biceps femoris.
The range of motion assessment is a preliminary procedure that must be completed before manual muscle testing. To perform this assessment, first, introduce yourself to the patient. Establish rapport and explain the purpose. Next, know the proper positioning in checking the range of motion of a specific joint or muscle group. In our case, we will be assessing the knee joint. To assess flexion of the knee, ask your patient to lie in prone. Third, identify the anatomical landmarks which you need to align your measuring tool with. We will be using the goniometer for this. Align the fulcrum with the lateral epicondyle of the femur, the proximal arm with the lateral midline of the femur, and the distal arm with the lateral midline of the fibula, with the lateral malleolus and fibular head for reference. Next, ask your patient to flex their knee while stabilizing the upper anterior part of the thigh to prevent hip flexion. After recording the result, push the leg of the patient towards the trunk to know the patient's passive range of motion. Then, record the result. To assess the knee in extension, have your patient lie in supine with the knee in flexion. Determine the same anatomical landmarks for your measuring tool. Ask the patient to extend their knee. However, according to Norkin and White, knee extension is not usually measured as it is just returning to the starting position of the leg.
MMT, or manual muscle testing, is a procedure that assesses the strength of a muscle or a muscle group. This is done by applying resistance to the patient's body part and asking to go against the resistance, which may be manually applied by the physical therapist, by gravity, by a machine, or by the patient's body. Just like in all other tests, the physical therapist informs the patient about the purpose, as aforementioned, and what positions he or she must follow for the test to be effective. For any and all MMT, the physical therapist starts out with a grade 3 out of 5, and from there, it will depend on the resistance of the patient. In assessing the MMT of the flexion of the knee, all hamstring muscles are involved. The MMT may be done starting from 45 degrees flexion of knee and maintaining of the leg in neutral position. Stand next to the limb being tested. The hand that gives resistance is placed around the posterior aspect of the leg just above the ankle. It should be noted that the resistance is applied in an oblique direction, down and out, or towards knee extension, for the muscle to be graded 5 out of 5 and 4 out of 5. In assessing the MMT of knee extension, the quadriceps femoris, rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis are mainly involved. Position the patient into short sitting. The hand that gives resistance is placed at the anterior surface of the distal leg above the ankle. Grades 5 out of 5 and 4 out of 5 entail the resistance is directed downward to the floor and towards knee flexion.
In assessing for grade 2, position the patient inside lying with the tested limb at the top. Then cradle the thigh and the other hand at the foot just above the ankle. Allow patient to move the knee, giving no resistance and assistance in movement, just for support. In assessing for grade 1, palpate for the tendons of the muscles. For extension, it is just above the knee. For flexion, it is on the sides of the popliteal fossa.